Which safety measures must the nurse take into account when weighing a patient who requires a sling scale? A. When rolling the patient onto the sling, make sure the bed rails are raised. B. Every time you weigh the patient, make sure they are dressed similarly. C. Both A and B. Which of the following tests evaluates fibrinogen and the clotting factors V, 7, and X to determine coagulation? A. Prothrombin time. B. Respiratory count. C. Partial thromboplastin time. D. Platelet aggregation. What is the term for cardiac compression brought on by an excess of fluid or blood? A. Daily. B. Flat. C. Fistula. D. Tamponade. What position is typically used for hemorrhoidectomy? A. Knee chest. B. Supine. C. Lateral. D. Jackknife. For a patient in the lithotomy position, which of the following is a suitable placement area for the electrosurgical ground pad? A. Anterior thigh. B. Posterior shoulder. C. Upper arm. D. Upper buttock. Where are Baker's cysts found? A. 10 minutes. B. Webbed fingers. C. Popliteal fossa. D. Surgically clean. A patient with a BMI of 30 is admitted for surgery. What potential difficulties during the surgical procedure can be brought on by obesity? A. An infection is more prone to spread to the patient. B. Anemia is more likely to develop in the patient. C. Diarrhea is more likely to strike the sufferer. D. Postoperative bleeding is more likely to occur in the patient. The term used to describe anesthesia that combines an inhalation drug, a narcotic, a hypnotic sedative, and a muscle relaxant is A. Local anesthesia. B. Regional anesthesia. C. General anesthesia. D. Balanced anesthesia. Which of the following is an example of a fenestrated drape? A. Systolic. B. Fistula. C. Mitochondria. D. Aperture. Which of the following is a normal adult white blood cell count? A. 20,000 to 25,000. B. 1,000 to 2,000. C. 50,000 to 90,000. D. 12,000 to 15,000. Which medications can elevate the patient's blood pressure in an emergency? A. Procaine. B. Epinephrine. C. Morphine sulfate. D. Succinylcholine. What is the name of the waxy secretion found in the external ear canal? A. Cerumen. B. Circulator. C. Trephine. D. Cerebellum. Which of the following actions will cause contamination when operating in a sterile field? A. Dropping items onto the sterile field. B. Getting around the perimeter of a sterile space. C. Keeping your gloved hands in front of your body, above your waist. D. Following positioning, adjusting the patient's drape. During the healing process following surgery, which of the following nursing diagnoses is the patient most likely to have? A. Disorientation and confusion. B. Ineffective thermoregulation. C. Dysfunctional grieving. D. Altered nutrition, less than bodily requirements. Which middle ear ossicle has the oval window covered? A. Parasitism. B. 85. C. Daily. D. Stapes. What is the suturing technique used to place brief lateral stitches below the skin's epithelial layer? A. Traction. B. Mattress. C. Subcuticular. D. Purse string. What surgical technique is preferred for breast surgery? A. Lateral. B. Dorsal recumbent. C. Lithotomy. D. Prone. Which dilator from the list below is used in the common duct? A. 55 to 60. B. Argon. C. Bakes. D. Teeth. What one of the following is invasive hemodynamic monitoring used for during surgery? A. To measure effectiveness of the heart muscle. B. To confirm changes in the patient's clinical status. C. To assess for depletion or restoration of electrolytes. D. Both A and C. Which of the following actions compromises the sterile field's integrity? A. Always facing the sterile field when standing. B. When scrubbed in as sterile, remaining within the sterile field for the length of the process. C. Setting up items ahead of time and covering them with sterile towels for safety. How should the stretcher be positioned when an elevator moves a patient to the OR? A. Enter head first, exit feet first. B. Acromioclavicular joint to iliac crest. C. Repositioning penetrating towel clip. D. Name, date of birth, physician. What circumstances are regarded as warranting a surgical vitrectomy? A. Foreign object in the eye. B. Diabetic retinopathy. C. Glaucoma. D. Both A and B. What catheter from the list below is used for embolectomies? A. Malacot. B. Angiocath. C. Foley. D. Fogarty. What is the name for the bacterial motion-producing thread-like appendages? A. Insulin. B. Flagella. C. Mitochondria. D. Fistula. Where should a patient be placed for a temporal craniectomy by the perioperative nurse? A. Lateral recumbent. B. Sitting. C. Prone. D. Supine. What sort of physical characteristics should a polycythemia patient with surgery present have? A. A bronze appearance on the chest and perineum. B. A ruddy blue appearance in the face, hands and feet. C. Pale appearance and flushed skin. D. Yellow appearance of the skin and sclera. Which of the following preparation methods is best for a split-thickness skin graft? A. Anaerobes. B. Chlorhexidine. C. Hypertension. D. Compound. During a transurethral resection prostate, the following factors control bleeding. A. Suture ligature. B. Cauterization. C. Gel foam. D. Irrigation. Hair should be removed in the following order before cranial surgery. A. Saved for possible transplant. B. Saved because it is personal property. C. Discarded. D. Sent to pathology. What type of surgery is used to treat a condition where the urethral meatus is located on the upper surface of the penis? A. Spinal stenosis. B. Incident report. C. Reverse Trendelenburg. D. Epispadias repair. When attempting to interview a patient with a language barrier but no interpreter is available, which of the following should the nurse do? A. Speak slowly and loudly to make sure the patient can hear you. B. When an interpreter is there, refrain from speaking to the patient. B. Act out some words while saying them to facilitate better understanding. Which of the following is an advantage of using depilatory cream to the skin prior to surgery? A. In some circumstances, the patient may use the cream on their own skin. B. Applying the cream is a cleaner method of hair removal than shaving. C. The skin at the surgery site remains intact. D. Both A and C. The inner ear spiral, conical structure is called the A. Cochlea. B. Penrose. C. Third. D. Formalin. What tool can be utilized to set up a patient for a total hip replacement? A. Andrews frame. B. Beanbag. C. Stirrups. D. Wilson frame. What bodily part undergoes preparation for an orifice of the humerus? A. Arm, fingers to shoulder. B. Arm, foot to shoulder. C. Arm, fingers to elbow. D. Leg, foot to hip. What is the medical term for the situation where a bowel loop herniates into Douglas's cul-de-sac? A. Epistaxis. B. Enterocele. C. Insulin. D. Meningioma. During a preoperative checkup, the nurse uses a tongue depressor to depress and move the patient's tongue. Which cranial nerve is being examined by this test? A. 7. B. V. C. 12. D. X. What features of the PACU might promote the psychological health of a surgical patient? A. There are numerous monitors, letting patients know that the PACU has cutting-edge equipment to support them. B. Low lighting is used during recovery to protect the patient from bright glare. C. The presence of so many nurses and technicians inspires the patient's faith in the nursing staff's skills. If an ovarian tumor is cancerous, what organs must be removed? A. Bilateral fallopian tubes and ovaries, uterus. B. Upper arms, neckline and axillary region. C. Never until the patient is discharged from the facility. D. Patient marks with an X and witness verify. What is the first part of the small intestine? A. Fistula. B. Duodenum. C. Cerumen. D. Love. Which item is necessary to set up a DAN-C? A. Cell saver unit. B. Cassette holder. C. Stirrups. D. Electrosurgery unit. In the course of an appendectomy, the following tools should not touch the appendix. A. Wiped with a saline sponge. B. Returned to the Mayo stand. C. Wiped with an alcohol sponge. D. Placed in a separate basin. What situations would make a cell saver transfusion inappropriate? A. Separation anxiety. B. Cancer procedures. C. Ultrasonic washer. D. Cottingham punch. What needs to be discussed by the nurse before using HIPACE for arteriography? A. Is the patient allergic to shellfish? B. Does the patient have high blood pressure? C. What is the patient's ethnic background? Does the patient have anxiety? Which of the following uses a binocular microscope to examine the cervix? Trauma. A. Colposcopy. B. Atherosclerosis. C. Acute. What bodily part undergoes preparation for an ORIF of the humerus? A. Arm, fingers to elbow. B. Arm, fingers to shoulder. C. Arm, foot to shoulder. D. Leg, foot to hip. The patient's leg should be lowered gradually when the position of an anesthetized patient is changed from lithotomy to supine to avoid A. Respiratory. B. Circulatory depression. C. Hypertension. D. Laryngospasm. What effects do antagonistic medications have? A. Counteract the action of another drug. B. Repositioning penetrating towel clip. C. Acromioclavicular joint to iliac crest. D. Upper arms, neckline and axillary region. When administering furosemide to a patient, which of the following interventions must the nurse take into account? A. After administration, check and record the patient's potassium levels. B. Keep an eye out for the patient's face flushing and tachypnea. C. Give the medication carefully, over about 2 minutes. D. Both A and C. What kind of operation would require tooth removal? A. Systolic. B. Insulin. C. Bacillus. D. Extractions. Which of the following straight catheters is most frequently used in the operating room before laparoscopic gynecological surgery? A. Malacot. B. Robinson. C. Foley. D. Pezzer.